Handstands on the beach, popping wheelies on vacation. These images do not paint a picture of a young man who was on the brink of suicide. But November 8th, 2021, Jake Pfeiffer took his own life. And his mom bravely shared Jake's story with me to save another life.
Other families do not have to experience the devastation that we have. It has changed all of our lives.
It's been more than 2 years since Denise Pfeiffer's oldest son, Jake, took his own life.
Our family was a normal, middle-class family.
When Denise reflects on those early years, there were no warning signs.
Jake did everything. He was fearless. Nothing was impossible for him.
But when Jake got into high school, he started to feel anxious to the point it was all-consuming. Denise got him into the pediatrician and tried to book a therapist. That's where the trouble started.
I certainly saw breakdown from start to finish.
Denise identified barriers to getting the right care that she wants fixed for other children. The first and most important is preventative care. It's hard to find a pediatric therapist.
The wait was 4 to 6 months.
That was in 2018. I asked Alyssa Bostwick with Golisano Children's Hospital and Kids Minds Matter if it's improved.
If a parent calls our Golisano LPG psychology practice today, you're looking at probably about a year wait.
A year wait.
A year. We have over 500 kids on our waiting list.
Golisano is trying. It went from one psychiatrist in 2017 to more than 40 today, but it's still not enough. Another issue? When Jake was Baker acted because he was deemed a danger to himself, Denise says the inpatient facility didn't communicate with her or his outside doctors who knew him best. But should they?
Yes. Does that always happen? No. And what I can say does for sure happen is when we are transferring a patient that has been placed under the Baker Act here and we're transferring to a facility, that one-on-one conversation with that receiving facility absolutely happens.
Bostwick says if you hit roadblocks, pick up the phone and don't give up. That is exactly what Denise is doing.
I am at peace knowing Jake is not hurting anymore, but I'm not at peace, and I don't think I ever will be, with the road that he had to travel to get peace.
And in the midst of all of this too, Jake turned 18, so his mom couldn't be part of medical discussions or any decisions. That can't change. That's HIPAA. That's a federal law. However, you can have your child sign a healthcare proxy form so you can just be a part of these kind of conversations.
And you know, if someone has ideas, just like Denise, for change, can they do anything with those ideas?
I think it's a really important question to ask because that's why Denise is sharing her story. She wants to create this conversation. Go to the website, if we can pull it up full for us here, kidsmindsmatter.com. You go to the advocate page and they have a button you see right there where you can actually contact your local representatives. And let me tell you guys, this works. A lot of the legislation that was passed in the Live Healthy bill that we've reported on extensively is because of our community's advocacy. It starts with including requiring a more comprehensive plan when a person's released from a Baker Act. And that way they know specifically how to target that individual. And then really important for all of us, recruiting healthcare professionals down to Southwest Florida because we know that is so hard to do.
So underserved.
And it's because of important stories like that Mother's There we just heard, that it's coming to the light now of all that needs to be done.
Yeah, her son's purpose, you know?
Exactly.
Absolutely.